Hello and welcome to Genomics Gupshup. This is the 20th episode of our Genomics Gupshup, where we invite experts who are either in the field of genomics or allied fields like oncology, mother and child, genetics, counseling, and so on. Today we have Dr. Amit Jotwani, who is a radiation oncologist, has practiced for many years before he founded onco.com. He focuses a lot on prevention and basically the entire oncology care. So we have a lot of interesting questions for him on that. But as usual, I'm going to first welcome Dr. Jotwani, and we will start first with who is Dr. Amit Jotwani? Right? Where did you grow up, and why did you choose to become a doctor in the first place?
So, thank you first of all, Anu, for having me at the Genome Gupshup. Quite interesting on a very complex topic. So, I am from Madhya Pradesh, MP, and though my father was with railways, so I was born in Varanasi, where he was posted at that time. Initial schooling happened, and then moved back to MP, did my medical education, then some fellowships, I did trainings, I did then one fellowship opportunity brought me to Hyderabad for that was a 1 year thing, and somehow as the destiny had it, I got a job. The Hyderabad adopted me and we stayed here since almost 13 years.
So, was there a lot of doctors in your family, or is it that you are the only?
No, I'm the first doctor in my family, in the whole family line. And somehow my parents also wanted, and initially, in fact, I never thought initially at school time that I would be a doctor. I wanted to be an engineer, even till 9th to 10th standard. I thought I would be an engineer. After 10th exams, and when I came to choose the subject, suddenly I had this thought, I should be a doctor only. One part that contributed to it was my mother was a heart patient, and at that time she underwent surgery and other things for her heart ailment, and that made me got attracted towards medicine. The impact of medicine is huge. It changes lives. It not just patients, the whole family. Like, we were also relieved by once my mother was treated. That had a enormous impact on me, and that made me switch towards medicine. And after that, just I started preparing for it.
So why did you choose oncology? I'm curious.
Oncology, to be honest, was not the first choice, but I'm a very preventive medicine fan from beginning. During my MBBS days, I used to do projects around disaster management, that initial first aid, basic life support. We did workshops, a lot of projects I did during MBBS itself. So everyone thought that, okay, he's a community medicine man. But suddenly, again, at the last moment, things changed again, and then I thought, if you want really major impact, then the cancer is the biggest burden on society currently, and the way it is rising, it is imperative that we work in this space. And preventive aspect can come any time of the career. So that was the reason I moved into radiation oncology, and just loved the branch after that.
So I was quite fascinated by the statistics, right? I mean, a lot of the cancers are clearly preventable, right? I mean, the large numbers of cancers that we see are largely preventable, but we don't see that many efforts in seeing patients become more proactive, right? I think most of the time they still go quite late to the doctors.
Correct. In fact, almost half of the cancers that happen, especially in India, are preventable. And secondly, it becomes much more important for Indian population to focus on prevention because the cost of cancer is very high. In general, healthcare costs are very high, and 80% of the healthcare costs are borne by individuals themselves. Government support has been lacking previously. And the way science is advancing, the cost of treatment is rising. So it makes economic sense also to focus on preventive lifestyle than reactive lifestyle when you have to treat. Another problem here in India is like we just don't care, we don't plan for health. It's an irony that we know that our health is going to deteriorate one day. We have seen it from ages that eventually health deteriorates, but we don't plan for ill health. We plan for marriages, we plan for education, we plan for honeymoons, everything, but we don't plan for ill health. So we don't want to spend money on health insurance. So, and when public is not interested, then why would the government be interested? So that's why the lifestyle part becomes a problem. Then we don't care. That's why the disease gets very advanced. 70% of cancers are diagnosed in later stages of disease, third stage and beyond. That makes the cure much more difficult compared to when you're, suppose breast cancer, if we take, if you're diagnosing the patient in first stage or even second stage, up to 90% patients can be cured. This cure word we don't use normally in cancer, but some patients still can be cured.
I actually had the same discussion. There are lots of friends of mine who there is a family history of breast cancer,
Correct.
and I keep telling them, why don't you screen? It is for your own good that either do a genetic screen or a regular mammograms or anything that, or go to a doctor, at least talk to them. Right? They don't do it because there's a fear. And I told them that whether you like it or not, that's going to happen. Now, if you find out early, you're likely to get cured and live a normal life. If you find out late, it becomes harder to get back to normal life. And it's not about you; it's the whole family. Right? My brother-in-law right now has been in the hospital for 2 months in ICU. The costs are, like you mentioned, ridiculous,
Yes.
right? And it's like completely disrupts everybody's life, right?
Lifelong income goes away in few months.
Yeah. So I think that's the kind of thing that people need to understand, that it is extremely important that if they can understand that something is there, you find it early, and if you find it early, the chances of treatment are way higher than
Exactly. Especially if you have known family history, then it is very important that you focus on the preventive aspect. Being proactive is important. Like I see like 4 advantages, 4 P's of even genomic testing or such an approach. Like where you can be proactive, you can have a preventive lifestyle, you can have a kind of a approach where you are able to predict. So prevention, prediction, preventive action early in time, a proactive approach helps you even save lives.
Absolutely.
So these tests, especially if there is family history, there are recommendations, scientific recommendations that you should go for such tests like genomic testing, where you would know that your blueprint, your DNA blueprint is pointing towards a risk, an enhanced risk. And it's not like if you have that risk, it would definitely happen.
Exactly.
But at least if you know that you have that risk, you would have a preventive lifestyle. You would avoid any other triggers that may make it happen. Like in BRCA testing we do, not all BRCA positive gene signatures would turn into cancer.
But at least they
They make those changes. They are more actively screening for the disease. They're having a better lifestyle, weight management, physical activity, and other factors. So you have to avoid other factors and minimize the risk. And that's the best investment that you can do in your health. Reactive approach, you have to go through the emotional trauma, the economic, financial burden that you have to bear, the loss of your productive life, the family gets affected. It's a psychological condition, cancer. So better to be preventive, be more active to prevent.
You mentioned that people plan for honeymoons and all of that, and I think one thing maybe people should remember is that your body is the only place that you will ever have to live in, right?
Exactly.
Regardless of it. So it's important to take care of
Your body is your best friend. You came when in this world, your body was with you. Other things would come and go. when you go, the last thing you leave is your body. So better to keep it in best shape. Jaan hai to jahan hai, as we say.
Exactly.
So we have to, and not just like it's proper well-being is important. So it makes sense to have a better lifestyle.
So I'm sure that you mentioned BRCA testing and others. Where do you see this whole evolution of genetic testing in cancer? I think cancer has become one of the most places where it's most used, right? And there is a lot of true value both in terms of treatment but also in terms of screening. And since both of us, I think, are big proponents of prevention, where do you see this whole genetic testing evolving over the next few years for cancer especially?
Genetic and genomic testing is going to become the major driver of clinical decision making also in future. We are seeing very rapid developments in the way we interpret these genomic outcomes versus the reality outcomes that we see in those genomic signatures. And we have found, in fact, when we treat with chemotherapy, we can now find out which drug would work better. Targeted therapies have come based on genomic signatures that we see, the outcomes that we see in those tests. And even radiation, what dose, what side effects can be expected, how aggressive we can be, all that initial results are very encouraging. In future, even preventive we discussed already, and there are, as we see, different levels of prevention. Maybe secondary and tertiary prevention when we talk prevention of complications. Secondary prevention is when we do screenings and all. So if you have your, as you already have a product called Genome Patri, so it's like Janam Patri, Genome Patri. So it tells you what blueprint you are carrying in your body. Every cell of your body is carrying a certain blueprint. And does it have anything that points to certain vulnerabilities towards any disease and all? So you can be more active, better treatment decisions can be taken, endometrial cancer, breast cancer, a lot of decisions, brain tumors, these decisions are being taken based upon genomic tests. In future, more targeted therapies are coming, immuno-oncology is evolving in a big way. So as we see, medicine is a science of correlation, and genomic outcomes are helping us correlate better in terms of disease outcomes, in terms of therapeutic approaches that we can take. So these genomics would become like an essential part of every workup, tumor workup that we do, tests that we do for every patient. So in future, I would say major decisions would be taken based upon such tests.
I think the cost coming down, I think, makes it easier for people to sort of avail these testing. I think, at least, so we have, other than Genome Patri, we have a cancer product called OncoMap, and then also we have targeted panels and so on. So do you feel that now there are, like you mentioned, that a lot of like the immunotherapies and other things are coming up. There are many types of genetic tests that are there. And do you see a lot of doctors aware of all of them, or are they? I mean, we definitely see a lot more, for instance, BRCA testing than others. Right?
Yeah. So BRCA is more of a preventive aspect where you check for any risks in the other members of the family, the progeny, the children and all. But that is more of a germline thing where you want to. It does not change your line of treatment or other things. But somatic testing that we do, those gene panels that you are mentioning, that helps us identify this, what is driving this cancer. So nowadays targeted therapies are being developed that help you target the right place which is really driving the disease, which is causing more and more, like the hallmarks of cancer where unlimited, uncontrolled proliferation is happening. But there is something that is driving it, that is stopping from other factors that should prevent cancer from not being able to act on it. So once we identify that driving mutation, especially in that sample at that moment, if you have right target, recently there was a news, very big news it became, everywhere you would find it. Some drug was found out in colorectal cancer, and like 100% results were found.
The small sample size.
Small, very small sample size. But see, I see hope in that. I may not see a paradigm shift in the way oncology is practiced, but at least that's a starting point to identify or to give you a direction to work upon. The costs are very high, still that is under development, that technology, that science is still unknown. We could identify a target which fortunately happened to be a driving target, major target, and that outcomes were very encouraging. But in future it would take a lot more. It's too much complex, and genomics is not the alone factor. Again, there are so many contributing factors to it. The overall, I kind of give an analogy of like a building construction. You are constructing a structure, say in India, in Kashmir, in Rajasthan, in different parts of the country, or in say Antarctica. Your practices would also determine not just the ingredients. Your structure, your architecture won't determine the longevity of the building, the quality of the environment around it. The
disaster,
raw
like
material, yes.
tsunami coming in.
Yes, so you have to plan things according to your own conditions. Similarly, our body is a universe of its own. Nowadays, there are so many things contributing in its microbiome. The drugs that you take, the outcome depends a lot on how your own bacteria, your own commensal co-living bacteria in your body are metabolizing those things. Your metabolome, there are so many proteomics and other things that have come up. So it's a mix of a lot of complex factors. We are in that space of a lot of unknowns, but we are on right track, I feel. So maybe next few years, next decade would be a game changer.
It's interesting you mentioned the microbiome because we are just working towards a product in that space. We feel finally the time is right. I think people have started to understand a little bit more about it.
Enough evidence has come at initial level for us to start looking for it. But we need to have build more database around Indian patients.
True.
So maybe reverse engineering of things where you identify patients and test them on all levels and then try to find out what all is contributing in our race, in our South Asian patients. So a lot of it, what we follow currently is coming from West. Even for our commonest conditions, which we are world capitals like cervical cancer, head and neck cancer, we get much more higher numbers than the whole world, but we still follow Western practices. So we have to, in fact, we should be teaching them. So we have to build our own database. So a lot of research investment has to happen, a lot of analytics has to happen, genomics and all should come in. That would help us.
So I think you touched upon a very interesting thing because you mentioned that we have a lot of specific Indian cancers, but we don't. Now the challenge for many people is that in terms of standards, we don't yet have a proper, just like you would have like an ECMG or otherwise. I think we first need to build that. And then I think once you do that, then I think it becomes easier to sort of create those guidelines.
Correct. So we need to have a collaborative approach so that like individual organizations or companies coming up doing things in a manner where whatever their capacity is limited to do things. So research requires sometimes much more than just a few companies coming up with small things, and companies have their own constraints to get return on investments and all. Also, we don't have big pharma companies like the Western countries have. So we need to have a collaborative approach where bigger organizations take the lead and bring everyone come together, so that the more authentic scientific information can come out, and somewhere our inputs matter to the world.
I think Indian doctors have had so much experience. There's so many patients that are there. I think if we can start putting all the information in one place, exactly. Maybe we can come up with better guidelines.
One area I see very interesting, where I find that I feel we can contribute a lot, is the real world evidence. See, majority clinical trials happen in ideal conditions. You choose correct patients, You have everything is ideal, but real world is not ideal. So, and we have a lot of real world data. We only have to know how to compile it, how to structure it, and then give out the analytics. And all doctors, all practitioners can come together and build over it.
I think the only challenge over there, and I think maybe we are the whole, the India stack is working on it, is that the data needs to be better, right? And I think once the moment you have the people start to understand the value of data, I think we will be able to get more data. And I think I like your idea of saying you have a randomized control, you are very specific about the
Yes.
same. But in the real life, I think there might be more variables than we
Exactly.
can.
That is why a lot of times what we experience in clinical trials, the outcomes that we see in clinical trials for new drugs, we don't see same results in real
In the
world.
real world.
Because we are there, we don't have those inclusion exclusion criteria. We have to choose something and make a mix
You
and
don't
match
choose
of
your
it.
patients, they come
You
to
don't choose,
Yes.
they come to you. And secondly, the kind of ideal scenarios that you are getting in a clinical trial scenario, you're not getting here. And the whole monitoring, the way it is structured, we don't do that in real world. So that is why many times we see real world the outcomes are less than the clinical trial outcomes.
So if we take the number of oncologists in India, do you think they are, equally distributed, or I think the big challenge is that there is so much disparity in terms of where you would find these oncologists and the quality of care. There's a lot of difference between being in Hyderabad versus being in a small town.
Exactly.
And how do we, is there a possibility to change that by any means, or is that
So,
part of what?
In fact, that was the main reason why I co-founded onco.com, to bring parity in at least the quality of treatment planning that the patients get. Anywhere in the country, every patient at least needs to have best treatment plan. Unfortunately, in India, due to various constraints, we don't have multidisciplinary approach. Uh, Oncology, 70% of medical oncologists are concentrated in bigger tier 1 cities, metro cities. So you don't get access to all the expertise in all the places. But then many times curable cancer condition patients also don't have a better or good outcome as it should be because of the lack of access to expertise, to multidisciplinary expertise. I am a radiation oncologist. I might not know what is best in terms of medical oncology, in terms of surgical oncology. Similarly, they can't know what better option might be there. So it's always a collaborative approach that matters. Unfortunately, in India, that collaborative approach needs to build up, especially in tier 2 and 3 cities. And this becomes very important because you should plan it correctly before you start treatment. If you don't plan it correctly, you are on a wrong train. Your destination changes, your outcome changes, and you don't get a lot of U-turns in this disease because disease is progressing at its own pace. If you are not right track to catch it or to treat it, you lose that opportunity. It's always important that we start from beginning with multidisciplinary approach, better plan, and then we move to treatment. So that part we need to work a lot upon. We work with almost 3,000 oncologists across the country, and we try to bring in that equity in cancer care. That's the reason we also made a small algorithm, mini AI based algorithm where any patient could check online by basic inputs whether they are on right treatment path or not, what should they do going forward. It's an automated software that is available on the website onco.com or on the app for free. And they just have to input data about four very simple things, and they get an outcome what test they should have done. We did a study where we found that only 35% of patients were properly tested. And when I say tested,
these are
routine tests,
35%
not
of-
very high end tests.
Correct. I'm saying these are 35% of patients who came to the.
Exactly. So some 400 patients were the sample size, and out of that 400 only, I'm saying only 35% patients had complete workup done. So very important tests were missing, and I'm talking about routine common tests that we do, not very high end like genomic tests and all. So that part needs to, unless you know the disease, you can't treat it properly. So a lot of gaps we need to fill.
So now the attitude that people have towards diet and exercise, that is changing. Right? We have started to see that people are becoming a little bit aware. But I think people follow fad diets, right, from the West. We had a little discussion about this earlier. But either they follow something from the West, or they go completely towards where they pick up something that would be there in another form, another science, let's say Ayurveda or something. But how do we get them to sort of understand it in a more scientific way and ensure that this is not something that becomes, because sometimes I think the problem is, for instance, I think even if you take Steve Jobs, I think his diet was only like raw foods or something like that. And apparently that was also a challenge in terms of the diet. Right? So how do we get patients to understand that there is a true value in understanding what diet might be best for you, both in terms of prevention, but also during. I think there is also a diet that you need to change while you are on treatment as well. Right?
Exactly.
So
another
we have a lot of experience in dealing with patients like that.
Yeah, diet is one of the most important factors that determines what kind of life we get, how healthy we live our lives. And when we adopt something, unfortunately, or whatever way, Indians do it in wholesale. Whatever we do in wholesale. If we adopt Western lifestyle, we do it in wholesale. Everything we are doing Western now. And if you adopt Western lifestyle, Western diseases also come as a
buy one get one free.
As a accompaniment. So you get those diseases also. Anything you get ill effects also. And the biggest ill effect is like cancer, diseases like cancer. So in heart disease, we have genetic propensity to have heart diseases. That is understood. As Indians, we have in our genes that risk is there. Now we know that, so we can live a better life. But we should not be blindly following everything that is happening around the world. We are fascinated by Western lifestyle, and we are giving a free way to their kind of preserved food, processed completely food, high fat diet. So I see that balance is missing. Sometimes you go overboard on doing some things, and sometimes you have to live the life also. So you have to live it in a way where you are happy also, you are enjoying life also, and you are living a healthy life, not just for yourself, for your family also. So it's important that we balance things in a way where it gives you live a fulfilling life. I feel it should not be very. It's my personal opinion. You should not be very particular about some things, because our bodies are different. Our generations before have lived a certain way of life. Okay, and we can't suddenly change that. If we change that, we are fighting our own inherent nature, our inherent blueprint. Okay, so we should. That Indian diet is very good diet in a way, in many ways, and only diseases that we had, the commonest cause of death in India used to be infections. Okay, and infections are preventable. You live a healthy lifestyle. Other things you don't need to change. Okay, so if you are controlling infections, other things are, and see, everyone has to die. There has to be some reason. Okay, the body has to deteriorate. But if we living a balanced life matters a lot, and in that, knowing your own body, what works better for you, what doesn't. Like some people, even if they eat very low amount of food, still they gain weight. Some people, they eat n number of amount of food, doesn't affect their body. So you have to know yourself. Knowing your body is important, and then living a balanced life that makes you like, if you are not eating anything that you like for your whole life, then what are you living? That is also a question that many people would say, what is the point in living if I don't eat what I love to eat? But then if it is affecting you adversely, if you are doing it in a way where it is damaging your own body, then how much you would live? So a balanced approach, I feel, is always important, and it should be following your own body, your own understanding your body. See, you are with your body 24 hours. Give it some time to understand how your body works, and it does not require medical advice. maybe some advice may be taken from health fitness experts, or maybe
Or
not. Genome is coming up that tells you what's good for you, what risks you have, and then you have to build a lifestyle which avoids those risks.
So I think we can understand if, for instance, for some people, I think the way they respond to fats is different than people who respond to carbs and so on. So what I did was consciously. I think I did. First, I did what most people do, which was like, how do I use a lazy approach to this thing, or you follow a fat diet. So I've gone through that process, and ultimately I realized that one, I think what I could find in my genes was an important piece of information that I used. The second was, what is it that I actually like? What is it I can stop and understand your own habits, and then you make those changes. Right? So that way you can optimize it without having and make it sustainable. Because I think the biggest problem with diets is you feel it's a chore, and then it becomes a problem. For me, it's a normal part of living now, right? And I think that's how it should be. Whether you want to incorporate some fitness, you want to incorporate something into it, it should be who you are. Right?
Exactly. So it should be tailored to ourselves. Yeah. We have to tailor our lifestyle, our diet, everything to our own needs, our own body's responses.
So nowadays, I think everybody is a doctor, right? Someone told me recently that Google karke everyone is becoming a doctor. So what is the most interesting myth you have heard about cancer that you see on WhatsApp?
So, a lot of things are coming up. It's many times it's very funny that like someone recently told me, okay, cooking on LPG gas is causing cancer. So like someone came and told me, is that a risk factor? So such a lot of, and Google, if you open Google and ask any question, you will find some answer. That does not mean it is authentic. Okay, so it's a very dangerous thing. Always better to ask from right people, and or right websites at least, trusted websites, maybe university websites or something. And there are a lot of false claims about anything. Don't change your lifestyle based on certain things you read on.
Not on WhatsApp.
Exactly. WhatsApp is the much bigger problem. It's a one-way traffic. It comes to you without you searching for it.
Yeah.
And I have seen a whole lot of misinformation campaign going on that. And it has been proven so many number of times, especially COVID times, where like the highest number of WhatsApp things came up for anything in COVID, everything.
Yeah, because people were at home, they had nothing.
They had nothing else to do. They would read, they would think about something, and they would make stories. There would be some one or two things where incidentally they found something changing. So that becomes an evidence. So we have to be very sensible about this. See, it's about body, about our body, our life. We cannot do anything that can damage our body based on reading some message or reading something on Google.
A lot of people seem to do that.
Exactly. So that's a shortcut method again. Sitting at home, and there's too much belief in this naturopathy, Ayurveda, or everything. See, it's good to believe things, but apply your mind. Even in Bhagavad Gita, Lord Krishna says, "I would guide you, but you have to decide now." So that decision has to be yours. So you have to be very smart at that.
I think I was just telling someone that when you think about a symptom, for instance, when you start doing a Google, you will probably find everything from pretty much whatever.
The most dangerous thing could be there,
and people will start feeling. They might be thinking about it. I'm going to get it, and I think they are stressing themselves, and stress can become a bigger problem of.
That causes, there's called tumor generating inflammation. If you are too much stressed on something, if you are having certain conditions that are causing more inflammation inside your body, that is an enabler for development of cancer.
Exactly.
So all these, cancer does not happen. Cancer is a combination of 300 plus disorders. It does not happen overnight that something happened. It's an accumulation of lot of injuries that your body sustains, and your thoughts are one of them. So unnecessary stress should be avoided. Go to right expert. maybe pay them the fees, that should not bother you, and then get right advice. But unnecessary stresses, unnecessary following anything randomly just because you read somewhere could be dangerous.
So now that you were just talking about advice, doctors are known to not follow their own advice.
Yes.
uh,
Doctors are worst patients.
so do you screen yourself also quite often, or?
I'm not yet reached that screening age for that matter, so I'm not yet screened. But I struggle. See, kind of work we do is, again, I was talking about stress, I was talking about weight gain and all. So, but we also end up getting that. But good part here is at least we try to mitigate it by other factors. We in fact, even I did not believe in genomics too much earlier. In fact, there are studies still now coming up that say the outcomes are not as they are claimed. But still, there are a lot of disease study material that is telling us things are important. And the kind of lifestyle we as doctors have, we have a sitting lifestyle. We are treating patients, seeing patients, sitting most of the time. So we spend and sitting is another smoking nowadays. So I'm trying to change. I'm trying to stand and see the patients more. But yes, true. Doctors are first patients, and doctors have below average lifespan. So maybe we need to create a movement around this. These doctors need to live a healthy life.
Yeah. So I mean, I'm hoping that we'll start following. I mean, more, because I realized that initially I was also too caught up in the whole, running a business, doing all that. But I realized, this is the kind of information we are giving out to people. If I can't be the one that can do it, so one of the risk factors I have is diabetes. But my father had it, mother has, whole family has it. Genetically showed twice as much risk as normal. And during COVID, it started to rise slowly, right? So once it reached 5.9, this thing close to this thing, I said this is then time to. So I got it back down. Now it's 4.9. So I think we have to realize that it's doable, and I think it's doable initially. Then when it gets to a point where it is, becomes harder to come back from. Same thing in cancer. I think there are many cancers that are, I think, preventable, but the ones that are not preventable, early detection is probably
that becomes a very important chance to cure them at least. So prevention, when we talk, there are multiple levels of prevention: primary prevention, secondary prevention, tertiary prevention. So prevention should not only be seen as preventing occurrence of disease. Prevention should be also seen as doing activities that remove the whole condition that cause disease, or catching them early, or preventing further complications, acting in time. Cancer is not a death sentence now. It's not like if it has to happen, it would happen. No, it's not like that. A lot of things you do that make it happen. So better is that we try to live a life, we are more vigilant about it. We say we live only once. So let's live it better and live it very smartly, vigilantly. Like we take care of our house, we lock it when we are going out. Why not take care of our own body? Anything can enter inside without this thing, and it can take away our health, so it should not be allowed.
So you feel that genomic screening you mentioned would become more commonplace? It would be something that would be part of most treatment purposes as well. So we'll start seeing much more.
Definitely, it has to be seen in a holistic manner because everything is correlated somewhere. Genomics alone does not determine everything. It gives you a track, it gives you a blueprint, it gives you a direction key. This is what can happen or is happening. But then you have to bring in other factors that to get a better outcome: microbiome, proteomics, radiogenomics, like how radiation responses are there is also coming from there. So it has to be, the science is evolving, but amazing opportunities around this.
So I don't know if many people know that the highest amount of the number of cancers in India are lip and oral cavity for men, right? And I think that might come as a little bit of a surprise to a lot of people, especially I think our audience, which is primarily I think urban.
Yes. So, in fact, tobacco consumption is the biggest culprit in this country
Yes.
because
Even for lung cancer.
yes, so tobacco consumption in any form, be it chewable tobacco or smoking cigarettes and BDs, causes a lot of cancers. Tobacco is mother of a lot of cancers. So now we know that, so we at least can have a better this thing. And lip oral cavity, when we that gutka and all, the way it is chewed, I would ask some patients, how many times you know? He would say only 2 or 3 times in a day. But they would keep that thing in their mouth for hours together. So that remains there. So now you are causing consistent damage to your cells. And the lining cells, lip oral cavity are the lining cells, carcinoma that we see happens most commonly. And you are injuring. See what happens if you keep on hitting. Suppose you are hitting a hammer on this wall, hit complete time. And suppose you hit 20 times hammer today, someone comes at night, does the painting and all, next day you come again, eventually it would develop a hole or a crack. That crack cannot be filled now. So that body's ability, body is very resilient, human body is very resilient to take on injuries, but then there is a limit to it. After that it becomes out of control. Because that healing process, see again, cancer is that uncontrolled proliferation. You are causing damage, and in the process of healing, new cells are being formed. Now you are causing so much damage on a daily basis that the speed of healing increases, and then the moment it goes beyond a certain point, that speed becomes uncontrolled and forms cancer. So, but interestingly, now breast cancer is becoming as a most common in general in this country. So earlier it overtook cervical cancer among women. Now we are going to see commonest cancer in this country would be breast cancer. So more and more women. Another important fact is like more women are affected with cancer than men in our country. And now commonest is breast cancer, so it would overtake oral and lip cancer also very soon.
So one more thing that some people probably are not aware, that men also can get breast cancer.
Yes.
Which I think is
around 2% of overall breast cancers are breast cancer. Men also have similar anatomical thing, other than the only thing that is rudimentary.
So anything else, or we move to the rapid fire?
Okay, we have more.
The last 2-3 questions I have.
Sure.
Yeah. Okay. So which is your favorite book?
One of the very favorite book is this by Yuval Noah Sapiens, How We Evolved. So that is one there, and I read very few books. I am more of a medical book reader, but few books that I've read have impacted.
Not the Siddharth Mukherjee's.
I have not yet completed it somehow. Didn't get a chance.
I think you already know a lot of that.
Exactly. That also reduces the interest, but it's very interesting book. I started reading, but somehow could not. Another book is about this, the difficulty of being good. That's how it explains you, the Gupshup task, how it explains you how Mahabharata decisions were taken, how it evolved. What is the analysis behind it is amazing.
Any hobby?
Hobby, we don't get time for hobbies. School time we used to have. Now we don't have time to do hobbies.
So the kids also remember this is the time you should have hobbies.
Build your hobbies. Yeah. Build another skill. Too much reading is also not so good. Your life becomes boring. So.
Okay. So if you were to write a book, what would it be about?
So if I were to write a book, quite interesting question. So see, it should be about the human capability, the capacity that we humans have. See, if we divide and capacity on both sides, capacity to destruct and capacity to build. We have been destructing only till now. We have not built anything for this earth yet. So we have to change that gear from reverse to front gear. And we have immense potential. And that can be seen from the fact that if you compress the timeline of generation of from Big Bang Theory till now into 1 year, then we arrived just 1 hour back, humans. And whatever was created, we are more on destructive path. We need to change that and work on building more.
Building more connection. I realized I didn't let you have your coffee.
No problem. The conversation was so interesting that I didn't need a coffee.
So thank you so much. It has been a pleasure, and I realized that we probably getting close to an hour. And if you have any last comments that you would like to say, we would be happy to get that.
Nothing, like all is said. Only thing is, like, let's listen to our bodies. Let's understand our own bodies, and then make a movement that we live healthier lives. We make life healthy for other beings, not just humans, for all the beings of this planet.
I think that's a very, very strong and profound closing statement. Thank you for that, and thank you very much.